I just want to quickly say I don't agree with you at all, Minister, in relation to nursing homes. I went along with the government, I did my best, and then I began to ask questions. And you talk about that we're better than other countries and all of that. I think what we shouldn't be looking at that, we should be looking at how we fail to prioritise nursing homes. I looked at all of the committee meetings that have been made public, and actually I paid tribute to the work. They met late at night, they met early in the morning, but notwithstanding all of that work, there was a neglect of the residential centres, nursing homes, direct provision and special centres for people with disabilities and mental health. I'm putting it back on the record. My question in relation to dentists has been answered, but I want to put on the record that almost 2 months after the declaration of a pandemic, we haven't made any provision in relation to the dentists and the service they provide. One sentence: I cannot overstate the sense of despair and panic in the dental profession, or the anger at what is seen as complete neglect of the reasonable concerns of our profession by the government. And that's repeated ad nauseum. So you're now meeting them. Can you explain how they weren't met up to now and how it didn't come up at the very specialist meeting? Number two, could you please drop the word cocooning? Now that we realise that it's insulting, unhelpful, and the whole policy in relation to over 70s has introduced an ageism and set back equality way back. Can we learn from that? And please drop the word cocooning. And then in relation to private hospitals, just before we mention that'll be my last point, and I'll leave a few minutes for the answer. I looked at all of the minutes, as I've said. Residential centres were mentioned, clusters in nursing homes were mentioned, but no sense of priority or dealing with them. What was even more astounding, from start to finish of all the minutes that I looked at, direct provision wasn't mentioned once. Can you tell me how direct provision never once surfaced at any of those meetings? Finally, private hospitals. I live in a city where we have 4 hospitals, 2 sister hospitals, Merlin and Regional Park, and Dogishka Private Clinic and Bonsecure, all functioning at under capacity, both the public hospitals and the private hospitals. Can you please confirm for me where we're at in relation to the agreement? You gave us the heads of agreement and nothing else. Can you please give us the agreement, please? And please tell us how many consultants have signed up. I'm from a city where I'm getting representations, people with cancer diagnosed can't get surgery, and we have hospitals functioning at 25% capacity. Could you please answer that for me? Thank you very much.
Thanks, Deputy Connolly. Minister, to respond.
Thanks to Deputy Connolly, and we've proper time today. Look, I think you and I are going to disagree on the nursing home issue, and that's absolutely, you're right. I would make the point, though, that we are recording, we are testing, we are getting an understanding of our sector that I don't believe many other countries have. And I do think when we get into the COVID committee, but also when we get past the pandemic, no doubt there will be lessons to be learned in relation to this pandemic. No country is perfect, and I'm happy to learn them, but I also think we should learn them from listening to, as you do in fairness, but from listening to the HICWAs, the regulators, to listening to lots of expert voices in terms of the work that went on, and I'm sure we'll get to return to that on another day. In relation to the dental services, there has been engagement. I'm meeting them tomorrow, but there has been other engagements. Emergency services have been permitted. There was a public health view in relation to the risk from other services, but as I've said, in light of the roadmap now and where the virus is at, we have asked for expert advice to see how we can try and resolve some issues in relation to dental services. Cocooning, I agree with you. I'm not passing the buck here. I don't know exactly how the word arrived, and we're all using it on a daily basis. It's certainly not meant to be offensive. It's actually meant to be about imparting the best public health advice to a group of people who are not vulnerable people, but who are vulnerable from this virus. Yeah, well, certainly in the government plan, the criteria that I report against now talks about how we protect and shield. And so the short answer is I'm going to be conscious not to use it as you request. In relation to direct provision, I mean, there was guidance drawn up by the HPSC. There was a group set up specifically on vulnerable users, including direct provision. The advice is very, very clear in relation to what
was in the last 30 seconds. How was it never mentioned once in any of the minutes I read from January till April? That's my question. So it was any meeting.
Yeah, but I can't, I don't know, I can't say what you read or don't read, and I don't mean that in a rude way. I mean, I do know that there was a significant body of work done in drawing up and publishing guidance by the HPSC. I do know that, and I do know there's been a lot of work by the Department of Justice and Equality in relation to that.
Thanks,
My department gives out the guidance, and we move on. On private hospitals, I'm going to send the Deputy the letter, sorry, the table I have here, but I do want to say this. We are meant to and purposely choosing to have some vacant capacity for a potential second wave.
Thanks, Minister.